I'm Dr. Jason Littleton. I'm a concierge medicine physician. I'm the Chief of Family Medicine at ORMC, Orlando Regional Medical Center. And I've been doing family medicine for about over a decade. And the interesting thing about it is that I didn't always do concierge medicine. I started out doing conventional medicine, okay? Fee-for-service medicine, reimbursement. And some of the things that I want to teach and talk to you guys about today is the difference between quantity reimbursement and quality reimbursement, okay? And many people don't understand how that can affect patient outcomes, patient care, patient satisfaction, but not just that, physician burnout. And I've been on both sides of the street. Like I said, starting out in conventional medicine and knowing what that was like, having gone through the burnout process myself, and now as one of the leading concierge medicine physicians in Orlando, I can tell you it's way better on this side. And I want to explain to you how that is. But first I want to start with a little story. In residency, I had an instructor by the name of Dr. Bancroft, and I remember going to see a patient, and when you go and see a patient in residency, you have to report to your instructor. In this case, it was Dr. Bancroft, and you review the case, and he'll ask questions, and just to make sure that you get it right and that you don't hurt the patients. Now, a lot of times we were seeing patients in residency who had Medicaid, okay? So they didn't have private insurance. This is governmental insurance. The interesting thing about this particular story is that I spent about an hour with this patient, sat down, looked them in the eye. You know, patient was very satisfied when they left. There was only one problem. When I went back to my instructor, Dr. Bancroft, I said, you know what? I spent an hour in there and I forgot to examine the patient. The biggest story of my medical career in terms of education that left an indelible mark on me is that he said, you know, wait a minute, you did examine the patient. You did, actually. First of all, note, the patient left satisfied, okay? But Dr. Bancroft said, listen, you did examine the patient. And I said, what do you mean? I didn't even touch the patient with a stethoscope. He said, well, let me ask you a couple questions. Was the patient in any respiratory distress? I said no. Was the patient having a heart attack? Were they able to stand up, sit down, and walk out? I said, well, no to the heart attack, but yeah, they were able to stand up, sit down, and walk out. Okay, all right. So the cardiovascular and respiratory system's fine, and neurological system's intact. Were they speaking fine? Did they have any slurred speech? No, of course not. Okay, so, you know, they're not having a stroke. Cognitively, they were intact. And so I was like, oh, wait a minute. Though I didn't listen to the patient physically, because I spent time listening to the patient, sitting down for an hour, and they left satisfied, I realized right then and there, I actually did examine the patient. Now, again, you know, whenever you see a patient, sometimes patients say, well, you know, the patient never, you know, the doctor never touched me, never listened to my heart or anything like that. So that's important. I'm not advocating don't listen and, you know, examine your patient. But the point here is that, you know, it's important to spend time with your patients. It's important to listen to them because that's half the battle. People leave satisfied when you listen to them and spend time with them. And I spent an hour with that person. Even though I failed to examine the patient, the point was still made that you can still understand what someone is doing by having good observation and listening skills. So I took that with me. And that has a lot to do with my message here on concierge medicine. And let me delve in a little bit further. In a way, I'm kind of radical, okay? Definitely radical to the insurance process, okay? They'll see me as radical. First of all, Webster's Dictionary defines radical as relating to the origin, okay? Or advocating extreme measures to retain or restore a political state of affairs. Now, I'm not talking politics here, but my point here is that when we think about spending time with the patient, concierge medicine, listening to the patient, That's old school. That's old-fashioned medicine. That's when the doctor went to your home, took out the stethoscope, spent time with you. There wasn't a waiting room. There wasn't a patient behind you or in front of you. You got seen on time because he came to your house. I'm a radical in that sense because that's what I do as a concierge physician. I go to people's homes. I spend time with them. I'm on time. And they're not waiting. They don't have to deal with the bureaucracy of the front desk or filling out paperwork. Yeah, and there's paperwork, don't get me wrong, that you still have to fill out. But when I'm talking about insurance paperwork, I'm talking about the time that is wasted with that. So in a way, I am radical. That's old-fashioned medicine. My patients feel like a family member or a neighbor, okay? There's a certain trust that comes with that, with house calls, no waiting room. There are certain barriers that are in place with conventional medicine. When I say conventional medicine, I mean fee-for-service medicine. Some of those barriers are time barriers. It can only be seen between 8 to 5, maybe. Physical barriers. Before you even get to your physician, there's a whole front desk that you have to go and talk with the receptionist. And if they, for lack of a better term, piss you off, then you leave unsatisfied and you didn't even see the doctor yet. Then, not just that, there is, I would say, flow barriers. How soon you get put back to the clinical, the clinical room to see the doctor, or people going in and out of the room asking you the same thing. The reception asked you the same thing. The MA asked you the same thing. Now the doctor's going to ask the same thing that was asked, and you're tired of it. That's a flow barrier. Other barriers that are interesting is that, again, let me go back to the space barrier. You're in a clinical room, a sterile environment, and as a patient, and I've been a patient before, you can feel uncomfortable. You're not at home. People sometimes have elevated blood pressure in this space. We call that white coat syndrome because they're not in their home setting. In their home setting, when they're doing what they're used to do, or they're doing what they normally do, their blood pressure could be more ideal, or it could be assessed more appropriately than in that test tube of a clinical setting when you're at your doctor's office. And I'm not against going to a doctor's office to be seen, because I even see patients of my own in my own office. But my point here is that there are barriers sometimes to appropriate care that can disrupt the trust between doctor and patient. There is a new barrier, and this is not a bad barrier. When it comes to the concierge physician and their patient, the barrier that I'm talking about here is now a new trust barrier. There's a trust that is developed between concierge doctor and concierge patient. Because, don't get me wrong, sometimes in the conventional setting, barriers are in place so people don't go and, beyond certain limits and cause there to be situations that can be very uncomfortable. People get worried about if you share your phone number with a patient, they're going to call you 24/7. They're going to rob into your family time. They're going to rob into your personal life, or they're going to meddle into your personal affairs. And that's just a myth. That can't be further from the truth, okay? So the new barrier, and it's not a barrier, between concierge doctor and patient really is one of trust, okay? And that's the only barrier in a way that we have in that doctor-patient relationship. And it's like anything. You have to trust your spouse. You have to trust your kids. You have to trust your employer. You have to trust your teacher. So when I'm working with my patients in this new type of relationship, being friendly, being kind, being honest, that is the barrier. So when I tell someone, when it comes to being worried that they might overcall you, I say, listen, here's my phone number, call me if you need me. The reason I don't get a whole bunch of calls at night is because when I sit down with my patient, I'm open, honest, I take the time, it's not rushed, and I answer any and all questions that they have. When you answer any and all questions that a person has, and then you tell them the outlook, they know what to expect. And they're less likely to call you 5 or 7 times a night. That's the good new norm that I want to advocate when it comes to concierge medicine. It's about treating people with respect. It's a whole new way. Interesting. When you treat people with respect, it leads to less lawsuits, okay? There's a New York Times article, and I'm going to quote this. Doctors call it defensive medicine. They order extra tests, perform extra procedures, or push far more office visits because they think that without them, they're at greater risk of being sued, okay? This happens all the time. It's so endemic, we don't actually realize it. But there are studies, and this comes from the Journal of American Medical Association, studies don't actually support that. There are studies that actually support that if you increase the level of communication and respect, doctors are less likely to be sued. So more tests, more office visits is not the way to protect yourself in terms of defensive medicine, but communication, time, respect, and a non-rush environment are. Studies support that MDs are sued often because the doctor didn't talk openly. Patients saying that their MD tried to mislead them. They didn't talk about risk or complications. Not spending time educating the patient. Or the feeling of the patient being rushed. Those were the top reasons why doctors were sued when respondents answered a survey. Now, conventional medicine, like I said, is quantity-driven reimbursement. Concierge medicine is quality-based reimbursement. Quantified reimbursement leads to physician burnout. Now, before I get into this, I did an article on my website, jasonmd.com, talking about what a typical day in conventional medicine is like. And I want to paint the picture for you here. Patients suffer the side effects of traditional fee-for-service medicine because sometimes it takes weeks to get an appointment. Sometimes waiting an average of an hour to be seen is an issue. And then when you're seen, usually the doctor spends 8 to 12 minutes with the patient. Don't get me wrong, doctors don't like this as well. Now, a typical day, if you think about it, is a doctor seeing about, in a conventional setting, 24 to 30 patients in an average day. There are studies that show that for a doctor to make $150,000, he has to really make $350,000 gross annually, all right? Now, at 15 patients a day, that's when that doctor just breaks even. He hasn't made a profit yet. So he's got to see that other 10 to 15, just to make a profit. You've got overhead with the staff. You've got overhead as far as the building. You know, there's taxes, of course. There's a lot of overhead that people don't think about. Now let's think about that. If I have to see 25 to 30 patients a day, that means per half day I'm seeing 15. Now, in a half day there's 4 hours. That means basically I have to pack in 4 to 5, sometimes 6 patients within an hour. So that means the visit now is definitely 15 minutes. Now, within that 15 minutes, what I found was interesting in my article is that doctors usually have to answer 24 phone calls within a typical day, 17 emails, 12 prescription renewals, have to look at 20 sets of labs usually. And this is not pertaining to you. This is pertaining to people who may not even be seen that day. 11 x-rays, review at least 19 consults of people that aren't even in the office that day or being seen. And yet they have to stay on track with seeing a patient every 15 minutes. This is assuming that someone who comes in has a basic problem and doesn't come in and start saying, hey doc, I have chest pain. Now that 15-minute visit just busted open to 30 to 45 minutes. And anyone who's beyond that patient now has to wait an hour, sometimes 2. They're frustrated. They want to leave the office. They don't want to come back. Now, when you go and see that frustrated patient and you go and explain why they weren't seen at 11 o'clock, they don't want to hear necessarily that the person in front of them had a heart attack, a person in front of them had a stroke. They're already frustrated. Now, flip side, think about the pressure on the doctor when we talk about physician burnout. You go into that room, all of a sudden you know you're going to walk into a patient that's mad and frustrated. There's stress on you. You're worried. You don't know how necessarily to take the fire out. You walk into that room, your stress level goes up. You can be nervous, you can feel anxious, you can even feel afraid. Some doctors can report that. So you walk into that room and you explain to them why you're seeing them late after they made an appointment 3 weeks ago. That's a problem. Not only are you tired and frustrated, but the patient leaves unsatisfied. Interesting enough, there was a Medscape National ND Burnout and Depression Report in 2018. 15,000 doctors responded to this from 29 specialties. Out of that, 42% reported burnout. 12% responded mildly depressed. 3% clinically depressed. When we look at the specialties that these doctors came from, 48% came from critical care. Another top percent came from neurology. 47% came from family medicine. I'm a family medicine doctor. Family medicine actually makes up the bulk of primary care. When we looked at the bottom tier specialties, 32% was pathology, another percentage was derm, and the other percentage was plastic surgery. So none primary care specialties. When they surveyed what contributed to doctor depression, top of the list was job, number 2 was finances, okay? Number 3 was family, number 4 was romantic relationships, and number 5 was health. But the top 2 things I want to point out were job and finances that contributed to physician depression. That's not burnout. But when we talk about burnout, the top issue was too many bureaucratic tasks. 56% documented too many bureaucratic tasks, meaning administrative paperwork, insurance paperwork, pre-authorizations, that sort of thing was the number 1 thing that led to doctor burnout. Number 2 was time at work. Number 3 was lack of respect from administration or your employer. Number 4 was EHR, medical records. Number 5 was they weren't paid enough. Okay, now let's think about it. I told you the average doctor has to make about $350,000 in order to make $150,000, right? And then they're dealing with unsatisfied patients in that model. That's a conventional fee-for-service model. And I've been there and I have felt burned out, and I have felt frustrated, and I have felt like I wanted to walk out of the office. I've had times myself where I found myself in a catatonic state because I'm like, oh my gosh, I can't feel anything in my body. I am so tired. I remember one time I went to a baseball game. I went to my employer and I said, I got to take some time off. I feel burnt out. So when I went to a baseball game out in Lakeland, and I just sat there and I was just looking at the field, not processing anything. I turned my phone off. I felt so frustrated. This was before I got into concierge medicine. It's not even worth it. I love taking care of patients. I hate making them late in terms of being seen. I hate being rushed. I want to make a good diagnosis. I want people to be satisfied. I want to please people as far as their health care. All right. So now, 2 years in to concierge medicine practice, my practice is called Littleton Concierge Medicine, the story's changed. I see about 2-3 patients a day, but if you want to know about how many patients I actually work with a day, I work with about maybe 10 or 15 a day. Because now, it's not just about being seen face to face. Sometimes I'm working with people through text message, phone call, or I'm going to their house, and so on average I'm seeing 2 to 3 people a day, but I'm spending an hour, sometimes to an hour and a half with these people. There's a trust there. They all have my cell number. They can call me anytime. I'm not worried about that because I found that none of my patients like to call me at 12 midnight between the hours of 12 and 8 because they respect me, even though I tell them, listen, your arm was hurting last night. You should have called me at 2 a.m. on Labor Day. Nah, I didn't want to bother you, so I'll wait for Tuesday at 8 o'clock. I'm like, hey, that's what you're paying me for. Bother me. My patients are more satisfied because if they weren't, they could just pick up the phone and tell me, we got an issue here. Let's work this out. And so I get an opportunity to work this out directly instead of them calling the front office staff and leaving the message and then me calling them at the end of a busy day of seeing 30 patients, being flustered myself and tired, and then picking up the phone and trying to work out an issue when I'd rather be at home at this point. My point simply is that higher satisfaction when you focus on quality reimbursement. Now, I get an annual fee. I'm not paid by insurance. You know, I charge patients somewhere between $4,000, $5,000 annually, but to be at their service 24/7, where they can pick up the phone on a holiday, pick up the phone at 2 in the morning and call me and we can talk. Understand, most of the time when people go and see their doctor after waiting an hour in the waiting room and making an appointment for, 3 weeks in advance, a lot of times it's like, hey, it's for a little rash or something like that, that they could have easily picked up the phone and called me and we could have, looked at it through, telemedicine. And I said, hey, don't even bother coming in. Let me just call you in a prescription. It's done. And yet there's this huge gap of time between the issue and the time it's actually being seen and dealt with, that time is money, money is time. That's not even, you're wasting money by not getting a quick answer. So my point here simply is that concierge medicine is the new form of medicine, but yet it's not new, it's old-fashioned. And I'm a radical because this challenges the insurance companies. The insurance companies don't necessarily want to hear this type of message, because this type of message means that now if people start going to a cash-based system instead of depending on an insurance-based system, now they're getting less money through less premiums. And here's the deal. One of the things that you have to get across, even though the commercials would say different, insurance companies do not care about you. That's right. They don't. They care about the numbers. They don't, because if they cared about you, the deductible wouldn't be so high. They care about your money. They care about how much you're willing to pay them. If you want better service through an insurance-based system, you have to pay to get a higher tier of service, even when it comes to medications and things like that. I would say that in that system, you truly are a number. Again, it's quantity driven. No one wants to say that. They will never say that. They will never tell you that, but it's the truth. That's how the reimbursement model is in that system. Concierge medicine, listen, if you're unsatisfied, you could go somewhere else. I don't get paid. I am driven to keep you happy, but also to be competent enough to make sure that accurate diagnosis is done. Because if accurate diagnosis is not done, you're not going to stay with me. If you're not happy because the communication's not there, you're not going to stay with me. If you cannot get me because of lack of accessibility, you're not going to stay with me. I am motivated and driven to be there, to pick up the phone, to get the accurate diagnosis, to spend time with you, to explain things. That's concierge medicine. And if you value your health care, more people would switch over to that model, because that model is really now all about you, okay? Yeah, people have to get paid, money has to be spent, but now the focus of being billing-centric, like in a conventional model, it really truly now is patient-centric. You're in control. And so I will tell you there's less burnout from the physician side, because now you're not on that hamster wheel, having to see 30 patients a day. It's a big difference between seeing 2 to 3 patients and dealing with 8 or 10 phone calls than seeing 30 patients, dealing with 17 labs, 11 x-rays, dealing with 19 specialty consults. That's a whole nother situation. The physician's refreshed, and if a physician's refreshed, he can think better, there's more clarity, and he can help you with whatever financial challenge you're facing. Likewise, if you're not frustrated before going into the visit because you waited 2 hours, you can further process what was said. And if he comes to see you at your home, now you're in your comfort zone. Blood pressure is more accurate. You're not waiting on the physician. And you can have a conversation as friends. It's a whole nother paradigm shift. So that is what I wanted to leave you with today. I want to advocate this whole new dimension or paradigm shift, so to speak, of concierge medicine, decrease physician burnout, and then you guys, patients, not being a number, and getting you guys to really consider a quality-driven type of healthcare, which is concierge medicine. So thank you. Take any questions that you guys have. The question is, how can you incorporate concierge, I'm going to rephrase it a little bit. How can you incorporate concierge medicine in a model where people can use insurance, but at the same time, it accompanies people who might have low income, might be someone who might be on like Medicaid or something like that. How could they get this type of true health care and not worry about the expense of paying $5,000 an annual fee or $4,000? I mean, is that kind of the point? I'm going to answer it this way. I set my own rate, okay? The government doesn't set my rate. So I can go to that person who really needs health care and be very altruistic and say, listen, you know what, I understand you can't pay my rate, but I do need you to pay something, but can you do $100 a month? Okay? That's a huge difference than $5,000 annually. I am in control of that, okay? So someone might be like, well, I paid $5,000. Well, that might be true. You agreed to that. Now, the person over here who is barely getting by but wants good health care, that's up to me to decide. That's my business, okay? If I really wanted to, people can give free care if they want to. I could give free care if I want to the people that I choose. And that's up to me, you know? It would be covetous or jealous in a way for someone to say, well, wait a minute. You can't do that because I just charged you $5,000. Yes, I can. This is my business, okay? I set the rate. If I want to help somebody out, if I want to give them a break, I can do that, and I have. I had a patient who paid $50 in co-pays, went to see a doctor 3-4 times a month, and was paying the co-pay of $50, and this person was like on Medicaid. So they were already paying $150 to $200 just to show up, okay? And I got this particular person onto concierge medicine, and they actually spent less money. And I went to their home, and I sat down with them. And whenever they went to the hospital, they felt like a VIP because I would show up. Oh, this is a Dr. Littleton patient? let's give the person the royal treatment. And it was like the patient loved it, just loved it, got the best care of their life, okay? And so I think that's one of the ways people in the private sector can advocate for their patients instead of paying a high deductible and not getting that quality of care. Does it kind of make sense?
No, absolutely. Thank you so much.
I will also add this. DPC, or direct primary care, doesn't take insurance, okay? I'm really a DPC provider. I don't take insurance. Concierge medicine, and again, my practice is called Littleton Concierge Medicine because the concierge part, most people know it by concierge, okay? They don't know what DPC is. So I'm really a DPC physician. Concierge medicine, which is still great, and it's not insurance-based medicine, yet it does incorporate insurance, okay, to a degree where it's kind of like, you know, people can use their insurance to pay for it, but they can also use cash. That's a whole lot different than being on the other side of the extreme where you're totally dependent on only insurance and for insurance to come through for you, okay? So there is a little continuum there. You gotta take it in your own hands, find a good qualified physician like myself who does concierge medicine, and you know, just be honest with people. If someone came up to me and said, hey, you know, I can't afford $5,000, but I do wanna see you, will you work with me? Yeah, I will. I will. We're gonna figure it out. We're gonna figure it out. That's old-fashioned medicine, and that's what they did in the old days. I love concierge medicine. I'm a huge advocate. I think everyone should be on concierge medicine. And again, when you are a concierge patient, you get the type of health care that I get. If I had an issue, I could call someone in my phone right now on a Saturday, probably go over to their house, be seen, and be on my way. In concierge medicine, you get the same type of care too.